all of our admission forms, the signalment of our patients, and our permanent patient records are going to be here in Cornerstone. It's going to have the client's name and address, all of their information, as well as the patient. So it's going to have our breed, sex, age markings, and then down here in our summary, we'll have everything that we've ever done to them, and if they have any records they brought with them, they should all be scanned into here as well. It'll have our lab, if we do any blood work, any things like that. All of our lab forms are kind of going to be in a mixture of here, as well as if we're doing anything to them while they're here for any procedures, it's going to be on our admission forms. So here is of our treatment plan. So kind of, this is going to be our patient. He's my cat. We're going to show him. His name is Nugget. Here's my name, my address, the doctor that's doing it. Nugget, he's a cat. He's a domestic short hair. We have his birthday on here, what we presume is close to his birthday. His weight, and that he is a neutered male. He was a male before he got neutered, but he is neutered now, so it shows up on there. So this was his neuter paperwork. So we would go through everything with the owners. We would go through the fact that they're going to get a small exam with the doctor first. They're going to get a they are going to get a little shave spot on their arm where they get an IV catheter. They'll get an ECG of their heart, make sure that looks good. They usually have preoperative blood work. If they haven't had that yet, we'll discuss that they'll get some blood done before the procedure, make sure all of our organs are functioning well, that we're safe to go under anesthesia, or if we need to go under a different type of anesthesia, something safer than isoflurane, like sevoflurane. They get IV catheter, IV fluids for the whole procedure. The technician will be monitoring them the whole time while the doctor does the procedure. They get a pain injection, and they'll get an endotracheal tube, and they'll be monitored through the whole thing. They get their nails trimmed while they're under. We use a hot laser, which helps cut down the bleeding time, and then we recommend, and we do offer a cold laser afterwards to help speed up the healing time. So on here it would have our blood work, or our blood work taken off if they've already done it, and then they go home with an e-collar. If they need any vaccines, we require, for cats we require FVRCP, rabies, and a fecal for them to stay with us. For dogs we require rabies, distemper parvo, bordetella, and a fecal for them to board with us or stay with us for any procedure. We offer microchips if we're doing any procedures on larger dogs with barrel chests. We offer the gastropexies, different things that they might want with them. And then usually they'll go home with some anti-inflammatory medications, such as carprofen or something like that. If they have any issues on their blood work, they may go home with a grapaprant. So here on the back of that paperwork is where we have any medications that we know they're going home with, and then they have to sign here for the authorization that we're going under anesthesia, and then it gives them the price, what we're looking at if they do everything that we offered them on these papers. This is our authorization for surgery consent. This again has the pet's name, color, gender, breed, owner's information, and what surgical procedure is being performed. So in this case it would be the neuter. It has the change of therapeutic plans, the risks and responsibilities that could come in, and understandings that there could be any emergency life-saving care could be required, and we take all responsibility, and they take responsibility that we're okay to authorize anything that we believe is necessary, and they will assume all financial responsibility. We get them to sign here, and the best way to contact them, phone number, etc. For discharge instructions, we are worried about the complications of the animal getting to their sutures. We want that E-collar on them, the Elizabethan collar on them at all times, so that they can't lick, chew, scratch at that incision site if they have one. With our feline neuters, we usually don't put any stitches, but they could still open it up, cause some bleeding, swelling, anything like that. They could possibly have a suture reaction. If the site looks infected, red, and swollen, then we want them to come in and let us know. We want them to watch for any diarrhea, vomiting, coughing longer than 48 hours after the procedure, inability to use the bathroom properly, anything like that. We would want them to call us and let us know. Usually they'll go home with an anti-inflammatory like carprofen that can interact negatively with drugs like aspirin, corticosteroids, or cortisone-like drugs. And that can cause vomiting, diarrhea, inappetence, maybe some skin or behavior changes, as well as excessive eating or drinking in a small percentage of cases. For restraint on blood draws, for jugular, you're either going to want to take off any collars, anything around their neck that might be in the way, or you can lift it up with your fingers. You're going to want to lift the head up if you're behind them and make sure they can't back up if they're a larger animal. On a smaller animal, you can use your hand or arm or something in the way of that. So you're going to want to put your hand on either side of their face. Make sure they can't bite you if they were to get upset or anything like that. And then this allows the person who's drawing blood a good access to their jugular vein. For cephalic blood draws, you're going to take the leg. The other person's going to grab their foot probably to get to their vein. We're going to roll the vein outwards so that they have a better angle at that. And for a saphenous blood draw, you want your patient standing. We're going to hold them in one spot and place pressure on the back of their leg here so that the saphenous vein stands out better. All right, when moving an animal in and out of a cage, some of your cooperative animals hopefully will just go into the cage and take their leashes off. You always want to be kind of non-threatening. You want to shut the door before you take their, as much as you can before you take their leashes off. Stop. Thank you. So that they don't run out. When moving them out of the cage, again, you want to approach kind of at an angle, non-threateningly. You want to open the cage. You don't want to get to the corner. You don't want to block the entire way, but you do want to not leave them enough space to just run out of it. And then, oh, sorry. But hey, when dealing with an aggressive dog, sit. You're going to want to have a couple of different sizes of muzzles. You don't want to be running back if you've got an aggressive dog to get a different muzzle. So ideally we would have someone else here holding her. Of course, she's not an aggressive dog. We don't need anybody else. But the small strap is going to go on the top of their nose. The thick strap is going to go on the bottom. You're going to want to loosen this beforehand because it's a lot easier to loosen it before and tighten it when it's on their head than it is to loosen it when it's on them. So you're going to want to push it this way. You're going to want to go fairly quickly, place it on their head, and come around and clip it, and then tighten it. With these aggressive dogs, the quicker you are, the better chance you'll have getting it on without them biting you. For taking our TPRs, our temperature, pulse, and respiration, we're going to take the thermometer, place it in the rectum, and wait till that beeps. For respirations, we're just going to count the number of respirations for 20 seconds and multiply that by 3, or you can count for a full minute if you like. So she's got a respiration rate of about 36. For pulse, we are going to find their pulse within their inner leg. We're going to feel for it and count for, once again, for 20 seconds and multiply that by 3. Or some people do it for 15 seconds and multiply it by 4, just depending on preference. So our temperature is about 101.1. Our pulse was about 90. All our vital signs are normal. Resting. Sit. Stay. Tighten. Tighten. At a normal physical exam, we're going to want to auscultate the heart and the lungs. So we're just going to place our stethoscope behind the elbow. Listen to the heart for any murmurs, anything abnormal. You're going to want to listen to it on both sides. Heart sounds normal, there's no murmur. Then you're going to want to go further up, listen to the lungs. Once again, we're going to want to listen on both sides. Which again sound normal. There's no abnormalities, no crackling sounds. Nothing like that. So on a physical exam, she would be an ASA grade 1, but blood work shows that she has slight kidney disease, so technically she's an ASA grade 2. All right, for a basic exam on a cat, to get temperature, it's going to be the same. We're going to use our thermometer. It'll go right in the rectum. Cats may need to be scruffed for this. A lot of them don't like it. And his temperature is at 100.7, which is normal. Their temperatures range anywhere from 98 to 102. So once again, we're going to find a pulse on their back leg. Their medial saphenous vein. And we're going to count. So his pulse is about 78, which is normal. We're going to count respirations. He's purring right now, so that doesn't help. So it's at about 54, but he's purring, so it's going to be a little higher because of that. So we're going to want to auscultate his heart and his lungs, just like we do with any patient. Once again, we're going to listen to his heart right behind his elbow. With them purring, it makes it hard to hear. Listen to it on both sides. And listen to their lungs. So both sound normal, no murmurs, no crackling, no fluid that you can hear in his lungs. So that assigns him a grade of an ASA grade 1. So he's normal and no abnormalities on his physical exam or any lab work. Thermometer. For placing an e-collar on a cat or on any animal, it's going to be put together. These have plastic straps that run through each to form loops, as well as keep it together. They can be tightened or loosened depending on what you need. So this is just going to slide over their head. Make sure the ears go through it. You want to make sure that their nose doesn't come past the end of it so that they can reach it. And then this can be tied with non-stretch gauze or a collar to keep it tight and make sure it stays on. For our jugular blood draw on the canine, we're going to go ahead and lift his neck, spray alcohol to wet down the fur and help the veins stand up. We're going to press here to make the jugular vein stand up. You want your hub facing towards you. Easy. Tight. You're fine. We're going to insert the needle. And that's a jugular blood draw. Anyway, for the cephalic blood draw, we're going to have the technician roll the vein, spray alcohol on it to help the vein stand up. Remove the cap. You want your hub up. You're going to look for and feel the vein, insert the needle, and that's how you do a cephalic blood draw. For the saphenous blood draw, you want them standing, and the technician is going to apply pressure back here to help the vein stand up. You want the hub up again. Okay. Insert the needle. And that's how you draw blood from a saphenous vein.
Okay. Do a different one.
This is a jugular draw on a cat.
That is safer.
So we're going to go ahead and lift their head up to expose the jugular vein. Spray a little alcohol, which will help it stand up.
Yeah.
Push
I know, I was thinking too. Like, I would love to give her a bath.
to make sure that the jugular vein stands up.
Like, has mom tried camping? Trying to get the stuff down there? The gather pen? I don't know. I almost asked, but you didn't? Because I had that problem. I was like out of camp food, so if I have to wrap, put it still. I'm just gonna go for the smallest thing possible.
And insert the needle with the hub up. And that is a cephalic blood. A saphenous blood draw on a cat. The cat is going to be in lateral decumbency. The technician is going to have the upper leg and the tail in her hand. She's going to put pressure with her pinky finger down on the leg. I'll spray alcohol to make the vein pop up a little better. And with the hub up, we're going to insert the needle. And that is how you do a saphenous blood draw on a cat. Now you're recording. So our minimum databases in the book that are required are a PCV, total solids, blood glucose, BUN, and ALT. In our clinic, for any young, healthy animals, any animal under 7, we require what's called a Chem 11 with a CBC through IDEX. So that includes a few more tests. It includes creatinine, the BUN creatinine ratio. It includes your albumin, your alk phos, a couple of other tests like that. If they are over 7, geriatric, or if they have any prior diseases that we're concerned about, anything like that, sick or injured possibly, we may require a bigger blood panel, what we call it's a CBC with a Chem 27. So that's going to include a few more tests. It includes your AST, anion gap, and other amylase, certain things like that. It also includes a T4 with it to check thyroid. And then if they're injured, sick, have any concerns, we may require them to have x-rays, or be on certain medications. We may require them to be on fluids before and after surgery. Kind of depends on the patient. All of our patients get an ECG before and after, not before. All of our patients get an ECG before their surgery to make sure that their heart rhythm is all set as well. All right, when they're going under anesthesia, we put the mask on them. Usually we'll give them drugs IM or IV beforehand to start the induction process and pain meds. We may give propofol IV, but for this video, the cats, we just are using an induction mask, and we've given them some pain meds IM. So we'll induce them with a We'll induce them with a mask with some isoflurane until that they are sedated enough for us to intubate them with an endotracheal tube. And we'll test that by pinching the webbing of their feet, making sure there's no response there. For these procedure being performed, if we do a cat neuter or a cat spay even, normally we'll choose the kitty cocktail, which is a mixture of dextromethorphan, ketamine, and either butorphanol or buprenorphine, depending on your doctor. We'll probably use buprenorphine. This gives them pain management, puts them under enough, and then we will use the mask with isoflurane and oxygen to kind of gas them down the rest of the way in order to put an endotracheal tube in, and then we'll maintain that with isoflurane and oxygen. This will keep the patient from feeling any pain, as well as sedated enough. We'll make sure that their isoflurane's turned up enough that you're not going to get any blink response, no pain response to the touching the webbing of their feet or anything like that, to make sure that they're under and they don't feel anything during their entire procedure. All right, for recording a controlled drug, we record them up on our board here to make sure that we get them recorded. I'm going to do Gracie right here. We're going to go to our controlled drug book here. We're going to go to the buprenorphine that we're looking for. It is 0.3 mg per mil. We're going to open it up. We're going to go to a page that is clean. We're going to record the date and time and the animal's name, first and last name. We're going to put the reason that we gave it, which is pain. We're not going to put how much we gave, which was 0.47 mils, and how much we have on hand. So we don't have enough, which means our drug books are off. We probably had a new bottle. There was a new bottle open, so we have to do our math, subtract 1.2 minus 0.47, which is, all right, and so that is 0.73. Now we have to go find our doctor to sign the book, and she'll put her signatures at the end. Here we have our anesthesia machine. So there's a lot of different parts that go to it. We've got our oxygen flow meter. This kind of shows how much oxygen we're putting into the animal. And as you turn this knob, this little ball, when it's connected to the oxygen, will go up. And you calculate how much oxygen you need by the size of the animal, what kind of animal it is, etc. We have our vaporizers here. This is a double vaporizer anesthesia machine. It has both sevoflurane and isoflurane in it. These are our where we put the inhalant in, so our intake valves. These measure how much and show how much vaporizer is actually in the tank. We also have our inhalation and our exhalation valves. So this is our where that valve. This is where those vaporizers will take the gas and combine it with the oxygen and go to the patient itself. So this is what they're inhaling, and this is what they're exhaling. What they're exhaling is going to go right into here into our CO2 absorber. This changes color as it gets used more and more, and will become slightly purple. It's a little bit at the top, but not too bad. This is our O2 flush. If we're trying to flush a large amount of oxygen out of these valve here, we can press through this. This is our pressure relief valve that opens and closes. Our tube that hooks in here. We have our bags, as well as you should have a bag that goes on here when it's all connected through. That is also dependent on the size of the animal, how big your bags are going to be. So there's a couple of different systems. There's our regular rebreathing system. It goes hooked up with the tube going straight to the animal. The inhalation valve, the exhalation valve is going to come through this way. That's our rebreathing system. You can hook it straight up to your endotracheal tube on the animal, or to a mask itself, and mask down the animal. You should have several different sizes of masks for big dogs, small dogs, cats, etc. For this, your oxygen tube is going straight into your inhalation and exhalation valves. This shows the pressure in the system. So when you push on that bag, when it's hooked up to an animal, it should hang around 15, 20 or so. And then with this, it also has the relief valve that goes straight into our bag and scavenger system, and that's where our exhalation is going. Now our non-rebreathing system is set up a little differently. So we're going to take our tube out of here for the oxygen, and we're going to place the non-rebreather small cord into there. This blue cord is going to go into this spot for the scavenger. So we're skipping this whole step right here. And it's going to go straight from the oxygen and into the scavenger itself. It has a bag. This bag can be small or large depending on the size of the animal. But usually our non-rebreathing systems we use for our cats, our smaller dogs, things like that. And this itself can hook up into the endotracheal tube, which I will show you. This also has an open and close valve on it. On the back of the system itself, we have the blue tube that hooks up into our scavenger and the green tube that hooks up into our oxygen. Those are our ports in the ceiling up here. The scavenging system itself is designed to take all of those waste gases that are breathed out by the animal and put them into a outside the clinic so that we don't have that. We're not breathing in that toxic air or anything like that. Alright, when testing for leaks, we have our oxygen tank on, and then we are going to place a water and dishwashing liquid solution on all of our joint tanks and valves and watch for any bubbles. Make sure nothing's leaking, like that. And there are no bubbles forming, so we don't have any leaks there. Grab the bag. Also, to test for leaks, I'm going to place a bag here. I turn on my oxygen. I'm going to close off my valve. And my bag should fill up with air. Which is exactly what it's doing. So we don't have any leaks there. You can also test it with a non-rebreathing system. Turn this on.
Well, I already have someone helping me, but thank you.
This bag fills up with air. Shows there are no leaks in our system. Here is our endotracheal tube. We check it for leaks by inflating the cuff, make sure there's no issues with that. When you inflate the cuff, it should fill nicely with air. There shouldn't be any air coming out, any leaks. It should stay well opened like that. As far as selecting the proper size of endotracheal tubes, it depends on the size of the animal. Usually use the body weight. Cats tend to be a 3.5 size diameter. Dogs can range from large to small, depending on what they're going to be. So we have our monitoring equipment already here. So there are several pieces I'll show you today that we use when monitoring for surgery. The first is going to be our pulse oximeter. So this is going to go either on their tongue or their ear, or between the webbing of their toes. We want to wet it with alcohol to just help it read better. Our ECG reads are reading nothing right now. So our pulse oximeter measures our SpO2, or the amount of oxygen that we're taking in. She won't let me grab her tongue to use it, but usually a tongue is a better. Well, it's not wanting to work. And normally that would be this little blue line. It would tell us our SpO2 here, right here, and this blue line would have a wavelength showing our SpO2. We want to have something around 90 or higher is preferable of our SpO2. It doesn't want to work. So our ECG, we don't have an esophageal stethoscope or gastric intubation, so I can't properly show you those. We don't use either just because there are more reliable things for, as far as esophageal stethoscope, our doctors don't like them. So our ECG on our anesthetized patient, it hooks up like I showed you in surgery, like I'll show you in surgery. It hooks up on their left arm. The respiratory monitor is part of our ECG. It counts our respirations. So when our ECG is hooked up, it counts how many times we're breathing here, and shows us on our monitor. Now our blood pressure cuff we have different size cuffs here. We can insert it. It can go on their tail, front leg, back leg, whatever your doctor prefers or whatever is easier for the surgery that you're doing. It places here. We can push our blood pressure button. It'll measure it every 10 minutes. Our blood pressure machine will. So it will count down and then give us our blood pressure here on these red lines. That will happen. And then our temperature probe is right here. It is just a long covered tip. It can go down their throat during surgery or in their rectum, depending on what surgery you're doing and if it's going to be in your way. The only one that ever sees it. This is Dr. Mari. She is my preceptor. She's the one that helps me out with most of my videos. Perfect. Alright, for a lateral saphenous catheter, we're going to shave these. I'm going to shave the area. See it? I shaved it. We're going to scrub it with our sterile scrub. And alcohol. We're going to draft the hair around it, but not the actual spot because you want to keep that sterile. Drying it just helps the tape stick to it. We're going to take our catheter and flush it with heparinized saline. Take the cap off of it. We're going to take the needle and insert it. And then you're going to tape it in. Just stay at it. Let's just go the other way. Tape it in. Alright, 2 pieces of tape, one around the top and one on the bottom. And then cover it with back wrap. until we're ready to hook it up to an IV line or place meds in it. Alright, for placing a cephalic catheter, we're going to shave the spot first. Change side real quick. We're then going to scrub it with chlorhexidine scrub and alcohol. We're going to dry off the hair around it just so the tape will stick to it better. But we don't want to actually touch the spot that we just scrubbed. I'm going to take my catheter and flush it through with heparinized saline. Gloves back on. We're going to leave the cap off, hub up. Our technician is going to roll so that we can find the vein. Poke. Aha. Now we're going to put the cap inside of it. And we're going to tape off.
It's okay, baby.
So we're going to tape with a small piece over and a larger piece that's cut underneath it. Then we're going to place the vet wrap over. And before I fully close it, I'm going to check to make sure that it's still in. And I'm going to use my heparin flush and feel the vein here, and you can feel it going through rather than forming a bubble there. Like that. An injection port on it. sure that it's not too tight. And he is ready to go. And all right, we're giving sub-Q injections. We're gonna take our FERCP. You're gonna wanna lift the skin up, poke right in, pull back, make sure there's no blood, and then push in. Let your needle, and that's it. All right, for giving IM and IV injections, we're going to find the vein here, joint your hub up, just like when drawing blood or inserting a catheter. As soon as you see the flash of blood, you're just gonna go ahead and inject in. Good girl. All right, for IM injections, you're gonna go ahead and isolate your muscle back here. You're gonna insert straight in, pull back, make sure there's no blood, and then insert. And you have to show Dr. Stevens.
You have to show me that?
Yes.
Yay. It's like a great activity.
We're good. All right. Intubating a cat. Go right.
It is possible. You might not have something. Did you get in?
Yep.
Let me see. Yep, you're in. Perfect. Good job.
All right. All right, since I forgot to show y'all earlier, the way to inflate the cuff when it's intubated, you're going to take a syringe, you're going to fill it full of air, you're going to put it right here in the tip of this, push it down, and put air into this tube. So I'll show you how it actually inflates. The way you check how tight it is by this little bubble here. You want it just a little, not too firm. You want it just a little bit of give to it. You'll be able to tell if it's not tight enough, if the animal doesn't seem to be, the balloon on the anesthesia machine is not inflating very much, or if the animal starts to wake up because they're not getting enough anesthesia. Now to uninflate the cuff, you're going to do the opposite. You're just going to take your syringe without air, you're going to place it back in this little tube, and you're going to suck the air out of here. And you're going to want to deflate the cuff before you try to take it out of the animal. Now, mineral oils in the eyes to lube them. Right, for palpating the bladder, we're going to squeeze in here and express, and she's got, and it looks like her bladder is empty. Good? Okay. All right, with cat neuters, we don't shave. We pluck the hair to reduce the irritation on the scrotum.
He probably should not be that, but it's not.
I know. I should be like, no.
No.
It's hard.
I know.
I'm just thinking, I'm just scratching that.
Well, no, I'm holding because
I know.
So we're going to start at the incision site and work our way outwards in a circular motion. We're going to do that with the chlorhexidine scrub and the alcohol, and we're going to do this at least 3 times.
When do you do it more than 3 times?
If you need a final scrub, or if you break sterility.
Or if they're just super dirty.
Oh,
It doesn't usually happen on the scrotal side, but sometimes the spay, the abdomen's gross.
We take all 4 corners and fold them up just to maintain control of the scrub sponge. Okay. And now we will sterilely move them into the surgery suite.
Hold, I'll come back to you.
Alright, you can stop recording that. So during the surgery, we're going to record what our ISO is at here, which is 2.5. Our oxygen, our fluid rate is 13. Our pulse is reading over here, 170. But we always want to check it manually as well. Our respirations right now are 12. Our sigh, which is our big breath. Our SpO2 reads up there, as well as our blood pressure and our temperature. 99.7. We want to check our mucous membranes, make sure that they're all good. And we're going to record that every 10 minutes. Thank you. Alright, so if I was to perform CPR, if her heart were to stop, it's going to take all of my might. I'm going to want to be up high if I need to get on the table. It's going to take a lot of strength for these bigger dogs. You're going to use 2 hands, place them here, and you're going to push relatively hard. You want to be able to compress their chest about 1/3 of the way at least to 1/2. And you're going to do that about 100 beats a minute, or to the beat of Staying Alive by the Bee Gees. So you would maintain compressions, and you're going to want to switch off with somebody every couple minutes because it does get tiring, because you do need so much pressure to do that. You don't want to stop when they're giving them breath, but you do want to continuously do it for about 2 minutes at a time without any stopping compressions. On smaller cats and moose, smaller dogs, you can use 1 hand around their chest and just do it that way. But with these bigger guys, you're going to need 2 hands. You're going to need to be up, and you're going to use a lot of pressure. If the patient were to go into respiratory arrest, we would need to use an ambu bag. That's usually a blue or different colored size bag that attaches to your endotracheal tube. If they were to stop breathing, you would disconnect the vaporizer, make sure that it's off, and you'd hook up the ambu bag to that endotracheal tube, and then you would compress that bag every 3 to 5 seconds until their vital signs come up and they start breathing on their own again. We're going to take off all jewelry, no nail polish, no nothing like that. First, you're going to want to put on all your masks, everything that you need beforehand. I'm going to use my sterile scrub. Put that on my hands. I'm going to start at the tips of my fingers. Use an art brush. We're going to scrub the tip of our fingers 10 times. And then we're going to move to the sides, the lateral sides through your fingers. All 4 sides you're going to do 10 times scrub. Make sure to get the inside and the webbing of the fingers. You want to make sure that you keep your hands above your elbows.
So you're doing a second pass on that animal?
Yes, in my pocket. Not in my pocket.
full, correct?
No.
You want that?
It's small.
When you do this on our fingers, and you want to scrub from the tip to the base, getting all of the webbing, and then you're going to do the palm of your hand and the back.
Sure.
We're going to repeat that on both hands and start with the tips of our fingers. You don't want to forget your thumb when you're doing it. You want to get it all over your hands before you're scrubbing them correctly. When you're washing them, you want to make sure not to touch anything and keep your hands, your elbows below your hands. Pull hard in the sink and let the water drip down your elbows. We also want to make sure that you're getting your scrub all the way up to your elbows. Once again, you don't want to get your hands below your elbow. All right. To dry our hands, we're going to come over here. We already have our packs and gloves set up. We're going to unwrap this one. That is already sterile since it's been in the other one. We're going to grab the towel and dry our hands with that. You don't want anything to go below your waist or your line of sterility. You're just going to drop the hook towel to the floor and leave it. Now I'm going to grab my whole gown and find the neckline. Just here. I'll let it fall to the floor. It's inside out. I'm going to make sure that I'm clear of anything. And have my technician tie it. You can stop it and tie it. Now that she's tied me in, I'm going to get my gloves. I'm going to use my right hand to take the left glove. I'm going to place it thumb to thumb, palm to palm, fingers down, and then holding.
You want to do stuff? Is that what you're telling me?
And go over.
Alright. Go ahead and put them back in the
Not
cell.
letting my fingers come out of the glove itself until it's in.
I said put them back in the cell. Put it back in his cell.
And so that's over your sleeve. Grab my other glove, thumb to thumb, palm down. This way. And go up and over again. Make sure your sleeves are still in your gloves, and that's it. Alright, our drapes we have on our sterile field here. Grab it. Let it drop. place it over the sterile patient. Right in the spot that we want it. We're going to take our towel clamps, our surgery pack.
No, down the line.
You're gonna do this every 10 minutes, every time that blood pressure goes off, that means it's been 10 minutes.
Every time it beeps.
No, the blood pressure. You look up there on the red on the bottom, that's the blood pressure. I need to sneak by there. Don't let it.
Clamp it. Alright. It's clamped on. Do you want to be Ryan?
Yep.
Yeah, if you can hand me the laser, Jenny, see if you will. Thank you.
Get away any blood or anything if we're doing an abdominal surgery. We just take the sterile gauze and block it. And if I was moistening tissues, can I have a bag of I put it over here. That's not good for it. Do you want to just put it closer to me?
Don't go across the surgical field.
Staying sterile with my sterile syringe and needle. Just gonna pull it up from here.
And if you would like to moisten the tissues for me,
I can't moisten. And just keep them. Now, if you were to puncture a glove, you want to re-glove immediately before doing anything else. If you were to drop anything, you want to leave it there, never bend down and pick it up.
what else do you need to show?
That's it. Can't stop recording.
Yep.
Alright, for loading a scalpel onto the scalpel handle, you're going to take your blade and your scalpel handle. We're going to point it away from us. You want it to go up and through and into the groove. Clip it on and pull it up to make sure that it locks. And then to hand it to our surgeon, you want to do it with the blade away from you, this way, and handle towards her. Alright, the proper way to pass your ring-tipped instruments, hemostats, needle holders, needle drivers, anything like that, is going to be just like this. And your proper way to hand any needle drivers, any curved instruments, any straight-tipped instruments that have your ring holders here is going to be just like this. Whereas your way to properly pass any hemostats, it's going to be this way. And that is both for thumb, rat tooth, brown Addisons, you're going to want to pass them down and straight out like this. Yep, you're good. And show me.
PBS, please. Tell me when you come in. Okay.
It's gonna be a bloody mess. Okay, so if you would please go.
And one of the places in told them that they had December and this girl was going to adopt it. Can I talk? Or are you going to adopt it? So she was going to adopt it or whatever, and then I guess they didn't perfectly follow their protocol for.
Alright, we're going to make sure our drape is put into the laundry. Get a laundry basket. This is for all of our drapes, our gowns, everything in there. We want to make sure that all our tools, if we don't need them, we can throw them away, such as syringes, any needles, any things like that. We want to go ahead and place in a sharps container. This we're going to throw away. Now, if we're dealing with anything such as a scalpel, here, we're going to make sure it's pointed away from us at all times. We're going to go ahead and find those needle drivers. We're going to take the scalpel off of there by pushing it back and not breaking it. The scalpel blade, we're going to want to take our needle drivers here. We're going to want to pretty much do the opposite of what we did last time, where we put it on, scoot it back, and take it right off. This is going to go straight into the sharps container. The less you can handle the sharps with your hands, it's going to be the better options. Anything with needles on them, you can use hemostats and needle drivers. We can cut the actual extra suture off of it. And just dispose of the needle itself in the sharps container. Any biohazardous material, of course, we're not going to want to place in here. We're going to want to throw that into a separate container with labeled for biohazardous waste and disposed of properly. All of this needs to go to the wet sink. We're going to go ahead and clean it so that we can get it ready to autoclave and be ready for our next surgery. We're going to want to make sure that we are wiping down all of our surfaces, our surgery tables, everything we place. Anything pretty much we use on here, any solid surface, you want to wipe down with a disinfectant. We use Rocal here, but I want to go ahead and wipe down my whole surgery suite. Of course, we don't want to spray any electronics, anything like that. You also want to make sure that your floors are cleaned after surgery, vacuumed, mopped, disinfected. Alright, for cleaning our surgical instruments, of course our gauze isn't going to be clean. We don't want to do that. We're going to throw away anything that's bloody and gross, anything that has any debris on it, and set that aside. I'm going to take my 2 trays. I'm going to fill one with water and dish soap to clean all of the blood and flesh or anything that the tools might have on it. And I'm going to fill the other one with instrument lubricant for all of our hemostats, needle drivers, anything with parts that interact with each other. Not so much the forceps or anything like that. Like with hip. Very good. Right. These are our tools that weren't used. These are our ones that were. We're going to go ahead and place all of them in our soapy solution. We're going to take a wire brush. We're going to scrub them down real good, make sure there's no debris on them. After that, we're going to rinse them with plain water. And then if they need to be placed with instrument lubricant, otherwise, I'm going to go get a towel and place it on them. Place them on a towel, make sure they're dry completely. Want to make sure our wraps don't get wet.
Alright, Dr. Bud, can you come up
You're
here?
gonna test your heart for worms, buddy.
Is that a scar?
It's something that happened at home. They told me about it.
Well, it just looks so obvious.
So something like this would go in the instrument lube to make sure that all these moving parts stay moving nicely. And that is also going to be dried off. We're not going to rinse the instrument lube up. We just dry it. So it's probably fine. All right. Well, so we're wrapping our surgical pack that we just wrapped here. It's our general surgery pack. We are going to take our 2 wraps here and make sure that they are clean and free of any tape, any debris, dry. You don't want to do them with wet wraps, anything like that. So, I'm taking everything out. I'm going to lay this out. I'm going to place this here in the middle with all my corners at either side of my dish here. I'm going to fold this over once, bring the side of both of these up, and this last side needs to come up and tuck in this way. Now I'm going to do a second wrap over that, my outer wrap, and I want it to be folded the opposite direction. So I want the tail end coming out at the opposite. So I'm going to start with it this way and wrap it here with these sides coming. So the other tail is here. This tail is going to be going that way. Make sure this comes in. This here, my tail. You want these to be as tight as possible. You don't want there to be any holes. You don't want to be able to see the pack in either way. So now that I've got this done, I'm going to place some masking tape on it to just hold it shut. Like this. And just so we are all aware, we write what it is. It's a general surgery pack. Who wrapped it? I'll put my initials and then the date that it was wrapped. Now on top of this, I'm going to put some autoclaving tape here. Just like this. And then it will go into the autoclave to be sterilized. Alright, once our gowns and drapes have been all washed, they need to be wrapped so that they can be autoclaved. for later use. So they are wrapped inside out, is the way to do it, so we can just drop them and get them done. So our autoclave is a gravity air displacement sterilizer. So that means distilled water is placed in the bottom, it's heated electrically, and then as it turns into steam, it's forced through a port. And once the air is out of the sterilizer, then the pressure builds until the operating temperature is reached. Then the steam is removed and it condenses back to water. Then you want to crack the door open so that all of that moisture isn't sitting on your packs after it's done with it. We're done. All right, when loading up our autoclave here, we're gonna want to place the trays in here. You don't want to place them to where it's too tight. You want to make sure there's enough room that everything gets autoclaved properly. You can slide out your trays, place things in there, and then slide them back in. Now, to start it, we're going to put it to fill water. You want the water in the autoclave to come up to this little line here, which it already has. So I'm going to turn off my water. I'm going to close the door, put the lock over it, tighten until it won't tighten anymore. I'm going to put it on steam. We're going to put it on about 273 degrees Fahrenheit, 134 degrees Celsius. I'm going to put my timer to at least 45 minutes, but ideally more. We like to do about an hour here. And then I'm going to hit start. My autoclave is going to heat up, pressures are going to rise in it, and it'll start the autoclave process. Once that timer's gone through, we're going to put it on extra dry. We're going to give it a second for the pressures to release and go down in here. We're going to unlock this door and let that extra steam come out and let those dry a little more. And we want that to go on for about 45 to 60 minutes. The proper temperature is between 250 degrees to 270 degrees Fahrenheit. The PSI is from 15 to 27 PSI, and it runs for about 15 minutes to reach a proper temperature, and then sterilizes in 3 to 15 minutes. The autoclave takes regular maintenance, cleaning it, making sure the distilled water is filled, as well as testing it for sterility. Making sure those sterile strips change colors and the autoclave tape changes colors. To show pack sterility, this autoclave tape here has turned black, as well as the little sterilization strip indicators that we have. these here, this line inside will turn black, and that's how you know that your gowns, packs, everything has been autoclaved properly. Yeah. All right. For our suture removal, we're gonna show her our incision here. And get it to focus. Looks good. Go ahead and remove the sutures. We've got our little suture scissors here. Go ahead and cut the very end of it. The suture scissors. And if you want, if you want to bring it closer.
Okay, I couldn't do it.
Oh, okay. Alright. I cut the bottom of it here. And now I'm pulling the ends of the knots out. And it healed beautifully.
Good job.